been patient and survivor of several cancers. The first one was prostate cancer, later kidney cancer, and the most dangerous metastatic malignant melanoma that nearly brings me to death after 2 metastases to the lungs. But hopefully, thanks to the efficiency of the cancer treatment in Spain, I'm still alive.
My wife is diagnosed with a breast cancer before 6 years. And of course, unfortunately, still continuing the treatment journey and the all follow-up procedures without the journey. And if I'm moving back on 6 years time, I didn't recognize the way how the efficiency is affecting the real patients and their family members. But in the moment in which we step into the process, affected by the journey, affected by the cancer, the story was totally different. And the story was the story of misinformation or not appropriate information provided.
I was the caregiver for my sister, Lindsay. Lindsay was my big sister, and she was autistic. So she was diagnosed in 2019 with stage 4 ovarian cancer, as many people are in the later stages of ovarian cancer. Just that is the nature of ovarian cancer. It is often diagnosed late, but it was particularly diagnosed late for my sister.
So primarily, I trained as a radiation therapist, and then I moved into my postgraduate programs within oncology. Over the years, I've been practicing as a therapist and then doing a lot of advocacy work for my country and Africa.
As a citizens, as a normal persons, we cannot understand all of the medical things. And when the information is provided, it's very important how it's provided. What kind of language is used to provide the information. But also it's very important what is provided as a written information. I think in 95% of the cases, the written information which is provided to our electronic health records or to our papers, medical papers, it's very ununderstandable and unreadable for the patients.
But I think we as patients, if we dedicate enough time and we study enough, we can unless to talk with them at the same terms. And when you reach this point, they start to respect you as someone that can contribute some views about the clinical trial or about why don't you use this treatment, for example. I'm very interested on melanoma, metastatic melanoma, and the best results, for example, for brain metastasis, in my personal view, are got through radiological treatment to the brain plus immunotherapy. Well, in some cases, I was discussing with an oncologist, he was not so fan of the radiology because he was an expert on immunotherapy. And I think it's very important that all the hospitals have teams to evaluate the combination of different technologies and drugs in order to get the evaluation. And in that case, sometimes someone outside or thinking out of the box can provide ideas to them. And when you reach this point, they agree with you and they allow to introduce more.
But to me, one of the issues is appropriateness, right? So I mean, we can make it fast. But the issue of making it timely, having enough money, having enough people, having enough doctors, having enough space, all of those things, which yes, we all need, we can all agree on. That is sort of building a system, a one-size-fits-all system, assuming that every cancer patient experiences cancer the same way. Pre-stories matter. And it matters when you have people who are either deemed to be disabled or who experience the world differently, cognitively, functionally, sensorially. And so how does cancer look like? How does that feel like? And what do we need to do with these things when we are talking about appropriate and even efficient cancer care? Because patient-centered is different for everybody.
Cancer and spirituality is a serious, thing in Africa, where people want to place their disease or their diagnosis to a spiritual source and think that what you are going to provide medically may not comprehensively provide the full treatment that they require. So they can even be diagnosed of a particular type of cancer. Treatment and everything will be planned, but the patient will not, go for the treatment because perhaps spoke to a family member, spoke to relatives, and then they said, oh, cancer is spiritual. You cannot treat this one in the hospital. This is a spiritual thing. And so they abandon treatment. And then maybe they show up later years with metastasis. They have to decide, and they are not giving you the go-ahead. You, the practitioner, cannot go ahead unless, they consent to treatment. And it's also because this cultural context play a key role